Welcome to Week 2 of Nursing 174. This week, we are going to move into the second trimester of pregnancy, and we'll continue with women's health across the lifespan when they are not pregnant. The second trimester is easier for the pregnant woman because the fatigue, nausea, and many of the other nuisance side effects of pregnancy are resolved. She feels more energetic, is looking forward to feeling the baby move for the first time, and settles into the pregnancy. We focus on adaptation to pregnancy for the patient as well as the family. In the second trimester, we continue to screen pregnant women for some of the complications associated with pregnancy. These include Rh incompatibility, anemia, and gestational diabetes. We also can do genetic testing in the second trimester. The prenatal visits continue every 4 weeks until close to 26 to 28 weeks. However, the second trimester is not without problems. This week, we will focus on this long list of problems that can occur in pregnancy. We have those that arise simply due to being pregnant: gestational hypertension, HELLP syndrome, which is a complication, placental problems, gestational diabetes, Rh incompatibility, premature labor, as well as problems associated with the cervix. In addition, we're also going to be dealing with medical problems that the pregnant patient has brought to the pregnancy, and some of these include chronic hypertension, rheumatoid disorders, cardiac disease, anemia, and the torch viruses. Then we're going to switch gears to learn about some of the GYN disorders that occur in women's health. These include abnormal bleeding, menopause, difficult periods, as well as PMS. So how do you study for this week? Well, you have reading, video lectures, and/or ATI to focus on all of the following. What do any of these disorders look like on the patient? What are the signs and symptoms of any of the disorders, as well as what are the signs and symptoms that are going to indicate to you that the condition is worsening? Consider what we have at our fingertips that can prevent morbidity and mortality to the fetus as well as the mother. What are the medical and nursing interventions, and what monitoring parameters do you as the nurse need to monitor? These would include labs as well as physical assessments. All of these are meant to keep the patient safe with the therapeutic management, so not only with the disease, but as well as what we do to the patient to improve the burden of disease. Last but not least, focus on the patient education. Try to explain each disorder and its management to a patient using language she can understand. What does she need to know to prevent a complication? What can she do to prevent worsening of a complication? Use the learning objectives for week 2 to guide your studies.